All right, we're going to get started. Welcome, everybody. My name is Sarah Levin. I'm the program coordinator for Jews for a Secular Democracy. For those of you who don't know, Jews for a Secular Democracy is a pluralistic initiative of the Society for Humanistic Judaism that is galvanizing the Jewish community to advocate for the separation of church and state. And today we're thrilled to have Allison Gill, who manages American Atheists Federal and State Policy. She's the Vice President of Legal and Policy at American Atheists. And she works to advocate for religious equality and manages litigation activities to protect the separation of religion and government. She's a nationally recognized expert on civil rights law and state advocacy. And prior to her work with American Atheists, she worked as a consultant to nonprofits focused on advocacy, strategy, and systemic change. She served as senior legislative counsel at the Human Rights Campaign, where she managed state-level advocacy on issues such as conversion therapy, bullying prevention, education discrimination, health and wellness, youth homelessness, and data collection. So the secular movement is very lucky to have her advocating for separation of church and state. And we're going to hear from her talking about the new State of the States report, State of the Secular States report. So definitely check out that resource. I'll drop the link in the chat. You can see where your state stands. And she's also going to be highlighting what's going on in a few of the states where Jews for a Secular Democracy has been focused. But certainly, if you have any questions about the report or about your state, you can check out the resource and ask her after her presentation. So I'm going to turn over to her, and then we are going to have a Q&A. So please go ahead and submit any of your questions in the chat, and we'll ask those at the end. So without further ado, I'll turn it over to Allison.
Thanks so much, Sarah, and thank you all for having me today. I'm excited to speak with you about the new report and also state policy in general. I do love talking about state policy. Let me just share my screen with my slides. 1 second. Okay, how does that look, Sarah?
Looks good.
Okay, perfect. So I'll start by here's our agenda. So we'll start by talking a little bit about what 2020 looks like in terms of state legislation, and also talk about this current legislative session, which is a very interesting legislative session. The last 2 years have been interesting. And then we'll talk about the State of the Secular States report. Finally, we'll talk about some advocacy tools and resources that we have to assist with state level advocacy. So before we get started on that, let's talk about why state level legislation is so important. So, a lot of times there's a focus on federal level advocacy, and states are sort of seen as an afterthought or not as good in some ways. But I'll be honest with you, states are where the vast majority of policy changes happen that affect most people's lives. It's very, very challenging to change things at the federal level, particularly because we usually have a deadlocked Congress. And, there's some administrative things happening, but for the most part, it's very difficult to pass, especially large bills at the federal level. And the federal government also has limited capacity sometimes to get things done. The state governments are much closer to the people, and many times are able to do things that are just impossible at the federal level. What's that saying? They're the laboratories of democracy in some ways. So one advantage of working on state policy is you can often make positive changes that you cannot quite make yet at the state level. And in doing so, you affect lots of real people's actual lives, as opposed to pushing for a bill for 10 years and getting nowhere, for example, at the federal level. It's also possible to oppose negative policy changes. We've seen, and I'll talk about this in a few minutes, a ton of negative bills coming through this year, but through advocacy at the state level, we're able to directly push back against them. One thing that's really important, especially for secular communities, is that there's this idea that non-religious people don't exist in different places in this country, even though, of course, non-religious people live all across the country in every community. And so by, being a visible local advocate, you're helping to convey to lawmakers that, non-religious people exist, we live in your communities, and you need to listen to us and represent our viewpoint just like everybody else's. It also helps build awareness and support for change if lawmakers know and understand what it is that non-religious people care about and what we're fighting for when we go seek policy change. And honestly, it helps local groups not only, show what they're doing, but build influence. If they're able to say, we're focused on changing the policy in these ways, we want to pass this bill or, oppose this bill. you come join us. It can be a really helpful tool for local groups that are building up to think about how they're going to engage in advocacy at the state level. And that can really draw members. A lot of people really appreciate being able to work in advocacy in a concerted way together. So American Atheists, since about 2018, has really shifted our focus to be on state advocacy. We really enjoy supporting local affiliates and advocates all across the country, and been working to grow communities and really help them to, assist them to increase their capacity for advocacy for different types of bills. So let's talk about 2020 and the legislative review for this current year, 2021. 2020 was an interesting year. It was not what anyone predicted, I think. It started off fairly normal, but beginning in March, we saw that the pandemic forced closures of the vast majority of state legislatures. So states were sort of chugging along. And then by the time March came along, a lot of them just closed, and some of them remained closed throughout the entire state legislative session. So basically, some of them just continued, considered zero bills at all. Anything that they were considering just died. Others met to pass a few, bills that sort of emergency measures dealing with things like public health, funding for schools or hospitals, or dealing with other sorts of emergency things that need to be dealt with during the pandemic. And some sort of stayed open and used the pandemic as an excuse not to allow people to sort of participate in democracy. For example, by closing hearings or by not allowing people to see what they were doing, which is really frustrating because there were a few bad bills that were rushed through. But for the most part, a lot of the negative legislation we see across the country really did not make it very far last year. There were far fewer bills passed overall in 2020 compared to most previous years. And also we saw, because of the pandemic, a number of different budget crises in many different states, and that's going to really be continuing this year. And I'll talk about some of the influences that we're seeing this year, but that is certainly something that weighs heavily on each of the states. We also saw, of course, in May, the protests and the after the death of George Floyd, that sparked a lot of discussion around reform of police and violence caused by police around the country as well. And so that was, that has also led to them considering different bills. Although honestly, most state legislatures were closed when that happens. This year, we're actually starting to see some of the follow through on that, and some places are proposing bills to make some of the changes that have been suggested through these protests and by policy advocates in these ways. And I also think it's important to understand that there was a number of really, really momentous Supreme Court decisions last year, which affected not only what happened in policy last year, but are really having important repercussions for state advocacy and what's happening in the states this year as well. So I'll just briefly go through some things that happened last year. Kentucky considered an extremely broad denial of care bill, the broadest we've ever seen, which a denial of care bill basically means that medical providers are able to refuse to provide care usually based on certain types of care, like abortion care, based on their beliefs. This bill was so broad that it was not limited to particular types of care, and it wasn't limited to medical providers. It was any healthcare provider at all, including insurers and facilities like hospitals. And any of them could, and also employers for that matter, they could refuse to provide any sort of care at all that they disagreed with, basically. So it was incredibly broad and very scary, honestly. I think the reason that didn't move forward in some ways was because of the pandemic. And the positive side, we saw Minnesota and Pennsylvania pass bills to end child marriage, which brings the total to about 4 different states. Ohio and West Virginia passed school prayer bills related to Project Blitz. I'm not going to go into depth on the Project Blitz on this conversation unless I get some questions on it. But basically, these were, I would say, overly broad school prayer bills, which in some ways, they focused on protecting the rights of some students who want to be able to pray in schools at the expense of other students who should be able to attend schools without being proselytized to or face, disruption of their school environment. And Tennessee passed a really unfortunate bill regarding foster care exemptions, basically religious exemptions that allow foster care and adoption placement agencies to discriminate. Also, Virginia passed several notable LGBTQ equality bills, one non-discrimination bill and one anti-conversion therapy bill. So these are just some examples of bills that passed last year. But like I said, this is about it. There was not a lot that passed last year that relate to our issues. Also really important to go through are just a few Supreme Court decisions that really affect the state of where we are now in 2021. So the first one I just want to mention, I'll just go through these quickly, is Espinoza v. Montana Department of Revenue. So this was a Supreme Court decision last year dealing with foster care systems. I'm sorry, I'm out of it. Voucher systems for schools, voucher systems, that basically said if a state has a voucher program that funds private schools, they have to also allow religious schools to participate. And so after this, it really blocked states from using their so-called no aid provisions, which are usually state constitutional provisions, which prevent money from going to, for example, religious education. They, in many ways, block states from applying those to limit the extent of their vouchers. And this is something that advocates of vouchers, school vouchers, have been pushing for a long time. They want to be able to channel more money from federal government, from public schools to private and especially religious schools. And so this had sort of been an impediment, these constitutional provisions. And because of that, we expected to see this current year a large number of voucher and tax credit programs. And we were not, well, I don't want to say we were not disappointed. We were disappointed to see that that is in fact the case. And I'll get into that in a moment. Also, another really important and positive case was the Bostock v. Clayton County decision by the Supreme Court, which defined or interpreted Title VII, which is the federal non-discrimination in employment law, to also include protections based on sexual orientation and gender identity. So basically, coverage based on sex or non-discrimination based on sex includes sexual orientation and gender identity. And then third is more recent decision, Roman Catholic Diocese of Brooklyn v. Cuomo. This was a case related to public health restrictions related to the pandemic. So basically, the governor of New York had put in place public health restrictions where there are outbreaks of COVID in order to prevent the spread of the disease. And the Roman Catholic Diocese challenged this, saying that they should be allowed to meet. And, you know, normally there's been a lot of law on this in the past. And normally what happens is you look at the restrictions placed on religious organizations and you say, are they comparable? Are they the same as what's being placed on similarly situated or secular organizations? So secular organizations of comparable risk, are they being treated equally? However, the Supreme Court really took a different approach in this. This was, by the way, sort of a preliminary decision. It was not a final decision on the merits, so we might see this type of case again. But the Supreme Court instead sort of looked at what the governor had enacted in New York and compared it more broadly to religious organizations. So sort of compared dissimilar situations, which unfortunately creates a sort of situation where religious organizations are favored. And if there are any exemptions at all in the law, then religious organizations must be exempt as well. So they didn't explicitly say that, but it's become a very murky area of law. And that sort of uncertainty is one we see states sort of leaning into in this legislative session. Also coming up in 2021, this year, is the Fulton v. City of Philadelphia case. The Supreme Court is currently considering this case, and this involves a foster care and adoption issue again. The City of Philadelphia had a contract with Catholic Social Services, who were contracted to provide some foster care and adoption type services. And as part of this, they were obligated not to engage in discrimination based on sexual orientation and gender identity. However, they would not agree to that stipulation, and therefore their contract was eventually rescinded. And basically, the Supreme Court's going to be looking at is, was this a violation of their rights? Were they entitled to the contract, or were they, that they have to follow the same rules as everybody else and agree not to discriminate. So we're going to hear a lot more about this in the next several months, because it's an incredibly important case for church-state separation. That was a very brief overview of a whole lot of important Supreme Court decisions from last year, but I just want to flag them because I think it's important to understand them in order to understand what we're seeing in the current year. So knowing about these cases, the prediction we made in the State of the Secular States report was that budget shortfalls will be a dominant factor. We'll see changes to healthcare, education, and policing based on the pandemic and the events of last year. We're likely to see legislation in response to Supreme Court cases, anti-LGBTQ legislation, religious exemptions, school vouchers, public health closures in churches, and restrictions on reproductive health care. So I am pleased to say that our predictions are very, very, very accurate, and that is exactly what we are seeing. In particular, I want to point out two different things that relate to church-state separation. The first is that we are seeing just an enormous wave of public health religious exemptions. So as I was speaking about the Cuomo case a moment ago, a lot of states have seen what the Supreme Court did in the Cuomo case, and they are, in many different ways, these bills vary quite a lot. They're trying to exempt religious organizations. It could just be places of worship or more broad religious organizations from public health restrictions imposed as part of the state of emergency. So these vary an incredible amount. Some are very, some have been used from state to state. So we're starting to see some of a pattern. Others are developed very organically, and they look very, very different from state to state. There are over 40 of these bills that we're tracking across the country, and we're really seeing some of the very broad ones move forward, unfortunately. It's been incredibly challenging to oppose them, honestly, because public health voices and religious voices haven't really been speaking out against them in a way that's been helpful yet. So, for example, we've already seen one of these bills be passed into law in Arkansas, which was one of the more broad ones, and we're seeing them being considered and move forward very rapidly in other states, like Arizona, South Dakota, Oklahoma, Missouri in particular. So that's one type of wave we're seeing. We're also seeing school vouchers and tax credits. So we're seeing a larger number of these bills following the Espinoza decision than we have in years past. And they're getting a bit more traction than they have in the past. However, I'm pleased to say that there are a number of different groups in most states that are working against these types of bills. A lot of teachers unions and education groups and school systems, sometimes state education departments, are used to sort of fighting back attempts to divert money from public schooling to private schooling. So there are many places already pretty well developed messaging and coalitions and people to speak out against these. So unlike when it comes to public health religious exemptions, which is sort of a new issue, and there isn't a lot of people lined up to speak out against it or a lot of messaging, here the opposite is true. And so we're not seeing quite as many of these move through, although there is a large number of them sort of in the works this year that we're keeping an eye on and fighting back against. And then lastly, I want to just point out religious exemptions in healthcare. So I mentioned the Kentucky law a few minutes ago. So that was an incredibly broad denial of care bill that moved forward in Kentucky. Unfortunately, it's been replicated in numerous different states around the country this year, and it seems to be moving forward, and it's proving very difficult to stop. For example, in Kentucky, it's already been passed out of committee again, and the same is true in Arkansas. So I guess a couple states over in Arkansas, where it's also been passed out of committee, and it's been introduced in several other states. And like I said, this is an incredibly broad denial of care bill. It relates not just to like your doctor who shouldn't have to perform abortions, for example, that's the rhetoric. It applies to providers, hospitals, insurers, and even employers. So if your employer does not like that you're getting a medical service, they can object to it and deny the service. It's utterly ridiculous and really scary, frankly. So I'm hopeful to be able to fight against these, but these are a new, scary, and very broad type of bill that we're seeing. So that's what we're seeing this year. I wanted to talk about, Sarah gave me the names of, a few different states where we have chapters of Jews for Secular Democracy, or affiliates. And so I want to talk about a few different state bills in those areas, starting with Florida and then Illinois and Minnesota. So in Florida, it's sort of a nest for bad legislation, unfortunately. We always see a lot of negative legislation in Florida. But this year, there are three things I want to point out. First, there is an incredibly broad school voucher bill. And we joke that Florida's never seen a school voucher program they don't like. The state has literally 4 school voucher and tax credit programs, literally 4. This bill would consolidate them and expand them quite a lot. So it's a very broad bill that combines and expands the school voucher, the existing school voucher systems in Florida. It also removes oversight. So currently there's audits that are required to be conducted of the people receiving, of these programs annually. This would move the auditing to once every 3 years, sort of inviting fraud. So it's unfortunate, and it's unclear whether we will be able to stop this bill. Like I said, Florida tends to love voucher school bills. This bill is getting a hearing, I believe, tomorrow. So, hopefully advocates will be testifying against it and trying to prevent it from moving forward. Another bill is a moment of silence bill in Florida. So normally we don't really talk about moment of silence bills. I think no one should be legislating to force students to have a moment of silence, but that's sort of not something that's certainly church state related. However, this moment of silence bill is located in the section of the law that deals with Bible class bills, if that makes sense. So it basically encourages Florida school districts to offer Bible class bills. So as part of that same language, they then talk about, you should also have a moment of silence. So in that context, it's especially troubling because you have language promoting just one religious perspective, Bible class bills, right? And then you have followed by language promoting these moments of silence. And there's no sort of, language about what to do if these are used to proselytize, for example, or to encourage student prayer when they're not supposed to be. There's no sort of safety provisions to protect students. So that's also troubling. And lastly, there's a Parents' Bill of Rights. And so this bill is a very broad bill that I'm not quite sure how to frame it because it's sort of a hodgepodge, but it sort of puts parental rights above a lot of different issues, like, for example, vaccination or sex education or, let's say anti-bullying programs. It basically gives parents the ability to opt out of just about any school program, and also things like, Florida has, for example, a vaccination law, like every state, saying you have to receive vaccination or to go to schools. Well, with this bill, they'd be able to sort of opt out against that. So it's sort of a mixed bag, and it's clearly meant to protect religious objections, but it's overly broad and sort of hard to pin down, if that makes sense. For Illinois, there's an interesting bill that I wanted to definitely talk with you all about. It's called HB 103, and we can tell this is a well-intentioned bill. It's meant to, as part of the Illinois Human Rights Act, sort of address anti-Semitism. However, the bill is framed in such a way and that it's overly broad, and it really sort of impacts some free speech issues in ways that are inappropriate. So it's, it just sort of drills down on anti-Semitism, but not other types of anti-religious discrimination. And it does so that it sort of brings in some politicalization of what anti-Semitism is into the law, and then makes it part of discrimination. It's kind of difficult to talk about conceptually. It's best to read it to really understand what it's getting at. But it sort of also brands certain speech as a representative of anti-Semitism. Let me just pull up the bill and I can give you some actual quotes here as opposed to just speaking. I apologize. here we go. So, for example, things that might be that the bill says are anti-Semitism are, let's see, calling for, well, I think it's better just to read it than having me repeat it, actually. But, you know, applying a double standard to the state of Israel by requiring behavior of the state of Israel that is not expected or demanded of any democratic nation. So, like, you know, that's obviously a matter of speech. It's not a matter of discrimination. Discrimination means something like in employment, or where you refuse to hire someone, or you fire them, or you don't promote them because of their identity, or in public accommodations where you refuse to sort of accept, you know, you refuse to serve somebody. It's not the same, you know, usually language should not be part of a non-discrimination in this way. But I just wanted to flag that, I think it's worthy of discussion and thinking about. And then lastly, I want to just mention Minnesota. Minnesota has, it already has what are called non-medical vaccination exemptions. So basically, these are, most states, I think every state actually, has laws requiring young people to get vaccinated before they attend schools. And Minnesota allows certain types of opt-outs for that. And some of them are non-medical, for example, based on the personal beliefs of the parents. However, they are expanding it to include religious opt-outs, basically. So that's what this bill would do, was allow religious opt-outs to vaccination. And we discourage that. Many states don't have religious opt-outs, and there's really no reason to sort of allow another way that people should not get vaccinated, because that, you know, hurts herd immunity. So that's some of the bills that we're keeping an eye on. I wanted to mention to you in the states where I know you folks are active. Okay, so with that, let me talk a little bit about the new report. I feel like that was a huge preamble. So the 2020 State of the Secular States report is available at atheist.org/states. And this is a review of the states where we look at all 50 states plus DC and Puerto Rico, and laws and policies that affect the separation of religion and government and religious equality in each state. We have a scorecard for each state, which I'll show you a couple of them in a minute. And we also sort of group each state into different categories based on the level of protections for separation of religion and government and religious equality. There are more than 40 different measures for each state that we looked at across the country. And they're really grouped into 4 broad areas: constitutional and non-discrimination protections, education and youth, healthcare and wellness, and special privileges for religion. So we do this report annually, and every year we try to iterate upon our previous report and expand to change to reflect the needs of the year, what we're seeing in state legislatures, and make sure we're covering everything as best we can. So we added a few new categories this year as opposed to previous editions. One, we looked at non-discrimination laws regarding religion. So for example, does the state require non-discrimination in education based on religion? So basically you can't discriminate against people based on their religion, school districts or teachers. This is, if it's the reason that we're concerned about religion, is not only covers religion, but it also covers non-religious people. So when we say discrimination based on religion, we mean it broadly on religious viewpoint. That's one of the reasons that we want to look at that. We also added homeschooling laws, which I think is incredibly important this current year, given, or in past year, given what's been happening. Most states have just terrible homeschooling laws in that they provide very little protection or coverage. A lot of them don't have any sort of precautions at all to make sure that students are being educated. And some of them, well, most of them actually, fail to provide any sort of barriers against child abuse, which can be a real problem, unfortunately. We looked at state sales taxes and whether religious organizations get special exemptions that other organizations don't get. And we looked at clergy privilege, or sometimes called clergy penitent privilege, where basically, mostly you hear about it in the context of Catholic confessional, where basically the state, you know, is not able to call people to witness or do discovery when during the course of a clergy, you know, confidential conversation. even if there is, for example, the reason that we're looking at this is in the context of child abuse. So basically, sometimes there's like a solid bar that prevents any type of discovery or asking someone to be a witness. However, in some states, they have an exception that allows a greater level of disclosure for child, in circumstances of child abuse. So that's what we were looking at for that parameter. And because I mentioned the earlier Espinoza case, we also removed the no aid clauses provision. We rank states into 3 different categories based on what their scorecards looked like in terms of protections. You can see about 13 states fell into the highest category, about 18 states were somewhere in the middle, and about 21 states had a lot of religious exemptions and were in the category with the least protection. And here is the breakdown across the country. And so now I'll just show you a couple of the scorecards for the states that we mentioned earlier. So here is Florida and Illinois, and these are what the scorecards look like. I'm sorry if it's kind of tiny. I wanted to just go through the scorecard because they can be a little bit, if you're not familiar with it, kind of challenging to read. So really, we're looking at, when you look at the dots for each item, we're really looking at 4 different things here. So basically, the item, we consider it positive if it's blue or negative if it's red. So for example, having non-discrimination laws that cover religion generally is good. So you can see those little triangles there are positive. And the having religious exemptions to those non-discrimination laws is bad. So that's a yellow, I'm sorry, that's a red triangle. And basically, if the triangle is filled in, that means that the state does have that policy or law on the books. And if it's empty, the law or policy is not on the books. So here for Florida, for example, you can see they have a state establishment clause, they have a state free exercise clause, they have non-discrimination provisions, but they also have religious exemptions to those non-discrimination provisions. Florida, you see there is quite a number of red arrows facing down. For example, there is a State Religious Freedom Restoration Act, a number of different types of tax exemptions, child negligence exemptions for faith healing, lots of different types of denial of care laws. There's, like I mentioned before, school vouchers, mandatory national motto displays. So schools, districts are required to have "In God We Trust" posters in their school classrooms in Florida. So you can see some of the negative reasons. And this state as a whole was sort of branded red in the 3rd category. So you see at the top, it says religious exemptions that undermine equality. And if you compare that to Illinois, which fell in the middle category, you can see there are a lot more, well, about maybe a few more blue arrows and a lot fewer red arrows, especially. So that's really the differences there. I'm happy to go over these more in question. I don't think it makes sense for me to go through dot by dot. That would take a long time. But if there are questions, I'm happy to discuss them after. And then I'll also have here Michigan and Minnesota. So you can see some of the other laws and policies. And these states both fell somewhere in the middle. They were not incredibly good or bad. Michigan just doesn't have a lot of dots filled in at all, especially when it comes to education and youth. That's why it was sort of in the middle. And then Minnesota has a few good ones, particularly around constitutional non-discrimination protections. In the report, we also looked at some broad categories of laws. For example, I mentioned homeschooling laws across the country. And so we mapped out in places where that had, different types of positive measures relating to homeschooling laws. And these maps are all available both on our website at atheist.org/states and also in the report itself, which is available as a PDF, or you can just download a scorecard or the PDF on the report. So you can see some of the states here. These maps are available online. And here's one on school vouchers and tax credits to show these are already very widespread. Lastly, I just wanted to talk through a few advocacy tools dealing with state advocacy. We have a number of tools and resources to assist local advocates focus on state level advocacy. I didn't really go into Project Blitz. I'm happy to if people have questions around it, but we do have a great resource on Project Blitz, which is basically a national campaign to undermine the separation of religion and government, LGBT equality, and reproductive rights at the state level. And that's at blitzwatch.org. So that has a few different types of bills, but honestly, we haven't seen that much activity from Project Blitz this year. So I don't really have a lot to say on that at the moment. We also track all the bills I've been talking about across the country. I think last year we ended up tracking, even as, comparatively unbusy as it was, 500 bills. And I think we're already up to more than 300 this year. So we track them all. They're all on our website, and you can look at what we're tracking in your state. There's also a neat form there. So if we're missing a bill we really should be tracking in your state, you can highlight it for us and we will track it. There's, thousands of bills in states across the country. So that kind of help is incredibly useful. So we appreciate that. If there's something we're missing, I really appreciate you flagging it for us to make sure we're covering everything. And we also did, not this past year, but the year before in 2019, with a lot of different partners, a survey of 34,000 non-religious people across the country. And that data can be really useful for advocacy at the state level and also the federal level. So I'd like to just include that as well, because that's available at secularsurvey.org. And that data can be really useful when you're advocating for policy change, either for or pushing back on negative bills. Lastly, you can sign up for our alerts if you're interested, or we also encouraging folks to send the State of the Secular States report to their lawmakers in their states. And we made it very easy for everyone to do. All you need to do is text the word states to this number, 1855 46 55 149. If you text the word states, you'll get a link to the action alert. And then if you fill it out, it will send the State of the Secular States report to your state, lawmakers, your senator and representative. And this goes back to what I was talking about earlier, the importance of showing our lawmakers that non-religious people exist and live in their districts, and they should care about what we have to say. So this is part of making that known. And also it will sign you up for alerts. So if we move forward with any action alerts in states that you live in, you will be informed about them. And so that is it. I'm happy to talk with Sarah, and we'll take some questions.
Great, thank you, Allison. So just to start off, we do have a one question in the queue, so I want to remind everybody to please, either in the chat or in the Q&A, submit your questions. But just from the perspective of Jews for Secular Democracy, kind of a broad question, but how can the Jewish community specifically leverage its voice to fight against these kinds of bad bills that are being advanced by Christian nationalists?
Yeah, that's a great question. So I mentioned, there's lots of different ways, to be quite honest. I think one of them is, I mentioned these public health religious exemption bills. Part of the problem is that, we're speaking out against them. Americans United for Separation of Church and State is speaking out against them, and ACLU is speaking out against them. But there are no religious voices I don't want to say none. There's very few religious voices speaking out against them. And also not that much public health. Public health perspectives are really important there. So, where they come up, I think it's incredibly important to have more people that can speak, with a viewpoint, like for example, a Jewish viewpoint, and talk about how it's not necessary. I mean, these bills, they're meant to protect religious communities, but they go far too far, and they create these really broad exemptions. And so people expressing that these are not necessary, they're worried about the implications of them, and that they endanger people's lives, I think would be really powerful. So there's none of them in the states that I've been speaking about today, or I would have flagged that. However, in other states, I think that'd be really important. So I'm not sure if that answers your question, Sarah.
Oh, I think it does. Really quick, if you could stop sharing your screen, that way we can see your face.
Yeah,
sorry about that. Great. So the other question was from, this was earlier in the chat. This was about the Supreme Court decision on on houses of worship and regulations on COVID. I can't remember but it was first Cuomo.
Yeah, cool.
And basically the question is, they said, is this a warning of what's to come? Like, was this a warning for the Supreme Court of how they're going to rule in the future?
Yeah, no, you're right. It was. I mean, prior to the death of Justice Ginsburg, they had been ruling pretty pretty about the same on these bills over a period of time, so consistently on these bills. And so we were not expecting a big change. Unfortunately, after Amy Coney Barrett was put on the Supreme Court, this was the first sort of case that they got that sort of shifted the narrative. And they're really using a different standard here that has not sort of been spelled out before. So before, Justice Roberts went along with the four liberals and it came out 5-4. And now we're seeing more of like a block of 5 on the conservative side. Justice Roberts is sort of in the middle, and then we see the 3 liberals opposing it. So we're seeing more of these, and it is concerning. And it's concerning not just in this field of public health exceptions, but also in other areas, because they're basically saying that religion has to be treated, not just equally to equivalent secular activities, but it has to be treated better, equivalently to or better than any secular exception, if that makes sense, which is a very different thing. It sort of puts that religion at a higher level of, I don't know, it basically gives it a higher level of deference than anything else in a way that could, and here we're seeing endangering people's lives, but in other areas, it makes me fearful of how the Supreme Court will rule in cases like Fulton, for example.
Thank you. Here's another question from Marlene. She said, I remember reading of situations in which religious daycares were not prosecuted for injuries and deaths of children. For example, some left in a hot bus. Is that still true in many states?
That's a great question. It's hard for me to say exactly. I mean, I think that type of state law varies incredibly a lot by state. So it's hard to say exactly what sort of the situation was or what state it might have been and how it differs from other states. I will say, I'm not sure this is exactly what you're talking about, but a lot of states vary in things like how much deference they give to religious, like healthcare providers. Like some states, a number of states have things like religious exemptions to child negligence laws that sort of allow like faith healing. And I know that's not exactly what you're talking about, but my point is that these vary quite a lot. And so, it's hard for me to sort of say anything generalizable.
I think if I'm not mistaken, that specific exemption on childcare centers, if it's not in your report, would that be on Child USA's website?
It very well might,
Okay.
because I'm not exactly sure what the exemption that Arlene's talking about there. So, yeah.
From what I remember, so I remember looking at this in Virginia because that's where I saw the most news reports on this and discovered that religiously affiliated daycares, at least in Virginia, don't have to file the same, like, for example, the caretaker to child ratio, like those kinds of regulations they're exempt from.
Yeah, we see that a lot, unfortunately. Yeah, religious daycares are often exempted from a lot of other requirements that other groups that need to follow. It's very, very common, unfortunately. So yes, but they vary about which exceptions are made by state. Sometimes it's to things like vaccination. Sometimes it's more broad. Sometimes there's just no oversight whatsoever, which is scary. So, yeah.
And Marlene, I do see your follow-up question asking if they don't have to get annual inspections. I think that the answer is it really depends on your state. So I would check Child USA as well as the State of the States report. I mean, it kind of depends. If you're talking about daycares, then I think that would be on Child USA. But you said, Allison, the faith healing exemptions are in the report, correct?
Yes, they are. And they're also on Child USA. So that's a great place to look. But yes, they are in the report. And that's a really interesting flag. And I mentioned we iterate upon this report every year. So it's something for me to consider as I think about what we put in next year. The thing I always think about when we're considering new criteria is it's something I can make, has to be able to something we can make it yes or no, if that makes sense. We have to be able to say, does the law exist or does it not exist? Because if you can't do that, it makes it, when you have that many items per state, it makes it very tricky. So you need to think
right. That might be tricky state by state because if one state has exemptions for certain things but not for others, so But definitely a good flag. Thank you, Marlene. Definitely encourage you to see and find out what the laws are in your state. Here's a question from Jeff. He said, as a long-term Kansas resident with little or no progress regarding secular and progressive values in my state, numerous roadblocks for us, how can I anticipate anything changing for the better here? He said, wouldn't it be a better option to just move away to a more secular community where my efforts are more likely to lead to better outcomes? Am I too pessimistic?
Well, I can't say that. I think that depends a lot on your, your personal capacity for moving. Maybe you love Kansas. I can't say. But, I think it's also important that we have people in states sort of push back on the negative stuff that we see in those states. And I think Kansas sometimes has a lot of negative bills. Although I'll say, Kansas has its issues, but we don't see Kansas pass that many negative bills compared to states like Arkansas and Tennessee and Missouri. Those states love to pass, and Florida love to pass negative bills. So I think that some efforts, and I'm thinking about Nebraska, for example, they've been killing some of the negative, really bad bills we've seen year after year. They've been really effective in sort of killing them. And so, I feel like even if you're not advancing the ball, sort of trying to work against some of the negative things that we're seeing is really important and productive and can make a real difference. So I'm not sure if that's helpful, but I encourage.
I think it is. Yes. And I would add, Jeff, that unless you really don't like living in Kansas and you want to live somewhere else, we need people like you to live in these areas to actually, to fight back the negative bills, like Allison's talking about. And things can change. And yeah, I would encourage you to think of the long game as well, when it comes to activism.
And you could always run for office.
That too, absolutely. So here's a question from Rick. He says, your concern about the Illinois anti-Semitism bill reflects many Jews' concern about the efforts of right-wing Jews to put into law the International Holocaust Remembrance Alliance's definition of anti-Semitism in order to quash criticism of Israeli policy. And his question is, while this is a freedom of speech issue, how do you see it as a separation of church and state issue?
Yeah, that's a great question. And I think it is a freedom of speech issue, but it's also a separation of church and state issue, because here what we're doing in the law is we're pulling, the law already provides non-discrimination on the basis of religion. Here we're pulling out one particular religion and saying not only can you not discriminate based on this religion, but discrimination means this huge amount of things. It doesn't just mean, it's not just protection like everybody else. It's like specific protections that are much broader than other groups. So it's sort of creating, and it's giving special protection under the law to one religion that's not available to others, or for non-religion for that matter. So that's why there's some church-state concerns there, if that makes sense. If it was like something else, if it was a little bit more reasonable, that might be something that would be possible. I mean, it's hard to draw those lines, but I definitely see some church-state issues because of that sort of level of in-depth and expansion. Like, for example, let's say that this bill had not been about Jewish people. Let's say it had been about evangelicals. And basically it was a bill in, Arkansas about evangelicals saying that, evangelicals shall be allowed to discriminate. And if you say that they're not, then you're discriminating against them. I mean, I'm just making something up, but let's say they spelled out this very, very broad, thing that this is what discrimination against evangelicals means. That would be really concerning. It would basically be, especially because they're the dominant religious group in that area. But, it would be, you could easily see how that's sort of putting their beliefs into the law in many ways. So that's part of the problem here. If they can do it for one religion, they can easily do it for another too.
Right. And I would also point out that, freedom of speech and freedom of religion are interdependent freedoms, right? They're both part of the First Amendment. And you hear a lot of that when we, that connection made when we talk about fighting blasphemy laws abroad, right? That a lot of the blasphemy laws are really just used to suppress speech that is considered blasphemous. So, it's important to keep in mind that those are interdependent freedoms. Here's another question from Barry. He says, the argument that you're trampling on my rights by forcing me to pay for insurance for my employees' health activities. I don't believe that's true. On what legal basis are these decisions being made?
I mean, it's not a legal basis. It's a law they're trying to pass. So I mean, they have the ability to do so in the different states. So it's not like a legal decision. It's simply saying that, you know, they have the right to opt out. I'm not sure if that makes sense. So this is, you know, that's in the law they're trying to pass. So they basically label folks like employers, insurers, self-insured groups as so-called payers, and then they make it clear that payers have the rights to opt out and not provide any type of care that disagrees with their, you know, I think it's even broader than religious beliefs, but like religious beliefs, philosophy, morals, etc. So that's basically the way it works. I'm not sure if that makes sense, but it's there, yeah. There's nothing else that they really need to do there. I mean, it's just based on the language of the bill.
Right, and that's at the state level. But would you say that you know, Hobby Lobby decision? I wonder if he's referring to the Hobby Lobby decision there, because that's. But is that related at all? Would you say?
No, not exactly, but it's sort of related. So I'll point to two different things. I'll come back to Hobby Lobby. So at the federal level, we saw under Trump, there have been for many years federal level bills that create so-called denial of care laws that say, for example, that, you know, if you get federal funding, then you have to allow medical providers that do not, individual medical providers that do not want to provide abortion care to refuse to provide that care. And the same is true for end of life care and sterilization. And those are all things that are at the federal level. Under the Trump administration, we saw them try to weave those provisions into like a broad right to deny care across the board for medical providers. That was stopped by the courts because there was no basis in law for it. So that was stopped. However, these bills we're seeing in the states would basically allow them to do that. What the Trump administration was trying to do by impose on federal law on everybody, we're seeing the states move forward. So it's not based on federal law, but we see it's a continuation of the same effort. Hobby Lobby is a little bit different. That is based on the Religious Freedom Restoration Act. So it basically it's sort of a separate measure, something else that's not really concerned at the moment. So it's not really related at the moment. It was basically an exemption from a federal requirement to provide contraception, and whether the Religious Freedom Restoration Act gave the Hobby Lobby the right not to provide the contraception. So that was not exactly the same point.
Got it. Got it. So just to clarify, so what the Trump administration tried to do was take something that was initially for individuals to opt out for very specific things, and then to have that apply to medical providers, not just the individual pharmacist or doctor on any kind of care on the basis of religion. Is that right?
I would say that maybe it was originally intended for individuals. It's been applied for medical facilities for many years. But they expanded the types of medical facilities that would be involved. They expanded the types of services that could be opted out of in different contexts. So, and it was a lot of changes. So it's hard to just characterize it briefly.
Right, right. And would you say that's what's being mirrored at the state level? Would you say that's kind of what the status quo is being expanded?
Exactly. Yeah.
Okay. So just to reinforce why it's so important to get involved in state level advocacy. So another question for you, how do you see, so one of the things we're doing at Jews for Secular Democracy is challenging and really condemning the weaponization of Judeo-Christian, because it really co-opts the Jewish community in a way that does not represent the values of the majority of American Jews, and creates a veneer of inclusivity that is not actually there, right? And so we're challenging that narrative, and I'm curious to what extent you see Judeo-Christian invoked when these bad bills are introduced.
That's a good question. I don't see it invoked all that often because I don't usually have time to watch the hearings. That doesn't mean it's not. It means I don't see it invoked.
Right. It would happen in the hearings, not necessarily
Yeah.
the language of the bill. Right.
I think that in a lot of places, depending on the state, they probably don't even bother. Like, there's no reason they'd even bother in a state like, I don't know, Arkansas, right, to say Judeo-Christian. However, I think it probably varies by situation and area. I think at the federal, I think that's something we most often see at the federal level too in those conversations.
Okay.
So it's hard for me to say. I agree with your point, though. It's definitely I don't know, a made up term to sort of, co-opt the Jewish community. Absolutely.
Yeah.
into these provisions. It's ridiculous.
Hmm. And we've seen it invoked a lot in Florida politics, unfortunately, as well,
Oh,
by
interesting.
both conservative Christians and the kind of one very right-wing um, Jewish lawmaker in the Florida legislature who tends
Oh.
to support those kinds of bills, unfortunately.
That makes more sense. It's probably a much larger community of Jewish people in Florida than there is in other states. I think where you probably see it more often when there is that larger community of people.
Right. So another question for you is, I know we didn't talk a lot about Project Blitz, but folks should be aware of it because we have mentioned it certainly before in our webinars. And Jews for Secular Democracy is a partner of the Blitz Watch Coalition. And again, if you want to find out more, go to blitzwatch.org. But the question is, with Project Blitz, kind of blitzing these negative bills, is there any effort to enact positive legislation, kind of do the same thing, but coming from the perspective of, shopping around good legislation?
I am so glad you asked. Yes. So yes, we have actually been working to push forward positive bills in different areas. In fact, Sarah and I did a webinar on this issue for another group last month. So we've been promoting several different positive bills. We have model policies, and other groups do the same. Like, for example, we support bills to end conversion therapy, right? And there's several bills, several states have advocates have been working to push those forward in different states over a period of time. But the bill, I think that's getting the most attention that we put forward is what we call the Patients' Right to Know Act, or sometimes called the Healthcare Transparency Act, which involves these denial of care laws I've been talking about. So basically, when a medical provider would claim not to serve someone based on a federal or state denial of care law, they have to inform the patient ahead of time, and they have to tell the Department of Health so that they can make that list of providers and what services they will not provide public. And that way people can, look up and see where they might be denied care so they can make better decisions about their medical care and where they should go. And part of the problem is, people can go to a medical provider and not even realize they're going to a religious medical provider. They might have no idea or they might not realize that a medical provider does not make decisions based on the medical interest of the patient, but on the religious, prescriptions of the provider. And sometimes that can definitely affect people, particularly when it comes to reproductive issues and also LGBTQ care. So it's a really significant issue. We're hopeful that this bill will make it so that people have more power to make medical decisions in their lives. We worked to introduce the bill in Arizona and Connecticut. We're speaking with groups in, I know that New York Civil Liberties Union is working on the similar bill in New York, so we're working with them. And also, I think there's a couple other states we're speaking with as well. So I'm really excited about these moving forward, and you'll definitely hear more about them over time.
Great, thank you. And then this is going to be the last question because we're almost on the hour. And this is a follow-up from what you were just talking about, Allison. David is asking, what about situations where people don't have a choice in their medical provider? So for example, an emergency or based on insurance policy coverage.
Yeah. I mean, that's what we're trying to fight against. I don't really have much to say there, except that, yeah, it can endanger people's lives when they are not able to access a provider that is going to give them the best medical care, but make decisions based on, their religious doctrines. It's harmful. Everyone should have the choice to go to secular providers, but in many places in the country, there are sort of healthcare deserts where there's only maybe one hospital or provider, and it is a religious one. And in those places, you just can't get the types of care. Like you maybe not be able to get sterilization care, for example, or you might not be able to get contraception. So it's really scary, and I hope we can do something as a nation to fix it. It may not be something that's always possible to fix at the state level through legislation. It might take longer advocacy to make sure that these situations to prevent mergers from happening in the first place, that basically allow these religious groups to sort of grow over a period of time. Or, this healthcare transparency measures might be helpful too, so that people understand what they're being prevented from accessing and getting. So those are two options, but they don't solve the whole situation. And yeah, it's a real problem.
A lot more work to be done. Well, we definitely really appreciate your work, Allison, and I want to encourage everyone to sign up to volunteer for Jews for Secular Democracy. I just dropped that in the chat. If you are not in Illinois or Florida or Michigan or Minnesota, you can still volunteer. That's just where we have active cohorts now. So if you want to start a cohort of folks, we do have resources like the ones that Allison shared with us today. We have partners with American Atheists, state directors and their volunteers on the ground. And there's model state legislation that Allison has drafted that we can be showing to legislators. So there's a lot of great work that can be done. And as we discussed, the Jewish voice can really be helpful as some of these bad bills come up, and certainly, you know, advocating for more positive legislation. So thank you so much for all the work that you do, Allison, and for being here today. Do you want to just, if you have any last shameless plug, or if you want to drop your contact information or anything in the chat, go ahead. Now's your soapbox before we wrap up.
Oh, it's okay. I think we've done enough, but thank you so much for inviting me. It's been really great to speak with you all, and I hope to speak with you all soon.
Great. Thanks again, and good night, everybody.